when we deliver a lab specimen with Colombo's dedicated direct delivery system, within 26 seconds from the farthest point in the facility to the lab is all it takes to get it there. Most hospitals are deploying more point-of-care testing in their hospitals because they can't get the labs to the laboratory in a timely fashion. At Westchester Hospital, we're actually pulling back on a good bit of our point-of-care testing because the time it's taking to get specimens to the lab is very short, and then our continuous flow in the lab is helping us get those results very quickly, so we're actually doing a better job than most of our peer group. When we designed the hospital, we had to get our approval from the State of Ohio Pharmacy Board. They love the model that we developed because we have a dedicated pneumatic tube system that goes from the pharmacy to a locked medication room. And then we can also take a badge of an employee and scan it on the pneumatic tube system, and we know who removed that medication from that system. That chain of custody in drug delivery is almost unheard of anywhere.
Cuts out all the transportation running to and from the floor for controlled substances, and also it decreases things that are lost to the floor. Each med room has its own tube station so that when one tube station goes down, it doesn't take the whole hospital down with it.
The heaviest use areas would be our pharmacy and our lab. These people are actually in control of the system, and it helps them to be able to get results to the best of our ability.
We've been exceedingly pleased, and I could not have predicted how this system has supported the high-quality lab that I was hoping to achieve in this new state-of-the-art facility.
The direct delivery is critical in our emergency department. From the patient care area to the lab is a matter of a few seconds. Very direct, redundant backup. Part of the lean concept is that our system has a clean pathway in which medications and pharmaceuticals travel, and then it has a dirty pathway in which blood and body fluids would transport as well. There's no commingling of the two systems. The Colombo system has many attributes, the first of which is the Colombo group of people. They actually listened to our needs, they helped us come up with items that would work specifically for us. So in that regard, that was phenomenal, because that's not true with every vendor.
The thing that made Ron Rolfing so good to work with is he came out of the trenches. When we talked about the specific issues of turnaround time and keeping caregivers with their patients, he understood it. We listened to what he said and what he needed, and we were able to deliver. And that was what made this job so much fun.
The 3D system that we have here at Westchester is actually smarter than we're typically using at this point in time. We still have plenty of opportunities to advance the system in its current platform. Its IT-based nature will grow with us. It'll actually meet our needs well into the future. So we have a lot of opportunities with our existing platform. My payback on my pneumatic tube system was approximately 25 months. We've really been able to find that that's been an exceptional payback for us. The level of service not even accounted into it makes it even a better payback for me.
The one thing that Ron Rolfing did was he did not scrimp at the beginning. He put the equipment where it was needed throughout the hospital. A typical example, the architect had put one station on each patient floor. He has 4. He has a lab station and a pharmacy station in each patient wing, which means the caregivers do not have to leave their area to use the tube system, to send blood specimens or receive medications. Great cost saving.
It has allowed us to have lean processes in our laboratory.
We're very happy with the Colombo 3D system.
In my opinion, 3D, dedicated direct delivery, is the wave of the future in hospital transport pneumatic tube systems. There is no other reason why I would take an alternative system, and I looked at them all.
I think our biggest strength, being a smaller company, is the fact that we will work with them and give them what they want. We will specifically solve their problem. I don't think a VP of operations could ask for anything more than that.